physical fitness is important.
Sure.
It's hugely important. It keeps our mind stable, keeps our body stable, like you're doing. You're losing weight, you're feeling better about yourself.
good,
It's
right.
amazing. But also, physical health is important. Seeing doctors, seeing dentists, knowing that if something's wrong with you physically, hey, I need to get that checked out. And, I'm not the most perfect at it. I got to get better, and I know you have a story to tell about that, that
Okay.
we're excited to hear
Okay, yeah.
and make fun of a little
Oh,
bit.
are
but,
we starting that already?
Yeah, you'll start already.
So I mean,
Let's start at the back and go from there.
my man, give someone like that. I like that one. Obviously, it's colonoscopy. So let's go like this. So my
We
family.
got some gloves back here. Don't worry.
So my family has we have cancer in my family. So when one of my aunts was in the hospital, they pulled us all back there. Actually, it was 2 aunts in the hospital, same time though, and they were like, "Look, and for colon cancer," and they were like, "Okay, look, guys, this runs in your family. So you men, you need at 40 years old, you need to start getting checked, right?" So I was like, "Okay, cool." So obviously some you don't look forward to. It's not half bad.
Not half bad.
So the worst part of it, obviously, is the day before, right? Because
The day before is the worst part.
Well, I mean, it really is because
Sounds like you might have been looking forward to it.
It's like you enjoyed it too much.
So I mean, it's just because you got.
Medically induced.
Have you done it yet? Oh, obviously you haven't.
Okay, you do it when you join the military. You go through
Oh, see,
MEPS.
here you go.
That
Oh,
happens.
so you've done it too.
Well, it's not something I want to do. It's just they
Yeah,
have to
see,
make sure
that's-
Were
everything's
you looking
fine
forward
before
to
you.
a day before?
No, I was not. I didn't even know what was happening. I really didn't.
Just bite down, buddy.
I didn't.
You got a lawsuit.
Anybody
on
that
your
joined
hands.
the military, you go into MEPS and they go through all your medical shit. And you stand there and you pull your drawers out and you're like,
Well, that's different. Okay, that's not
You
colonoscopy.
got a finger. You got a snake.
I got a tube and a camera. You got a finger. That dude said I didn't know what was gonna happen.
They took a picture of you and a video of him.
This dude doesn't even know what to call it. No, it's not the same thing.
hey, if something goes up there, I don't care what it is. It's the same fucking thing to me, man.
An inch or a foot, you're in there.
Dude.
You're in there.
No, man. So colonoscopy. So the day before is you got to drink all this stuff because you have to be empty. So it's basically you're just drinking whatever all the medicine. So you're just literally crapping all day. It literally sucks, right? I mean, you're empty when you go there. So when you go there, it's not a big deal because I mean they put you to sleep. I'm not awake when some dude's still dropping my drawers and sticking fingers up there.
Cough twice.
So exactly. So it's a little bit different. So anyway, so the story is I don't know why I did this. So it wasn't my
You were
fault.
a
I
one night
wasn't.
stand. They took him on a date.
They took him
on a date.
They took me on a date so that I get knocked out, and it was funny because I'm sitting there and when I'm laying down on the
You got roofied.
no, I was laying. They put me down, and I'm laying there, and I'm like, dude, you're gonna have to fix my pillow because it was uncomfortable. I said, and I looked up at the dude. And that was it. I mean, because I was like, I am uncomfortable. This is not gonna work, right? So then when I wake up, the nurse comes over there and she's like, all right, it's time to get up. So I was like, cool. I was like, man, I just had the best dream. Now the thing about it, I wasn't thinking when I said it. I have no idea what I was dreaming, but it wasn't what you guys are thinking.
It wasn't what you were thinking. It was what you were feeling. And you were okay, huh?
So I said that, and I looked over at the nurse, and I was like, "Oh,
Does
good
Katie know
God."
this story?
Yes, she does. Yes, she does. So,
Same time next week, huh?
so there's my story. I don't.
Oh, man.
Again, it wasn't that. It just
Have you dreamed again since?
not that good of a dream. So there's my story.
Oh, man.
So there you go.
You know what, though? I mean, even though we're having fun, we're having a great time over it, but it's important.
Oh, yeah.
It's important, especially when you had a family that, had cancer and things like that. It's important to get that stuff done. Even though it's uncomfortable as hell, I can imagine, and weird as hell.
Yeah.
It's important.
It's not that bad.
It's not
10 out of 10 would recommend.
Right.
Oh,
But
man.
I mean, I know sooner or later I got to get mine, and
sharing a couch
Pedro
with this
and
guy.
all this stuff. Yeah, but I mean, it's important for men to do that. It is, and take care of other stuff. I mean,
sure.
you guys might not know. I mean, you guys know this, but our viewers, I don't know if you guys noticed by watching us, I kind of try not to smile too much or laugh too much. I'm missing 2 teeth, one on each side right here. Okay. Not because, I'm on meth or anything like that. Right. It's, I did not do a good job taking care of myself.
Okay.
COVID happened. Sarah was born. You'll watch episode 5 of Sarah's story and everything she went through, being in NICU and, in CTICU for months on end with heart surgery. Taking care of yourself is the least thing to do.
Sure.
That's the least thing you need to worry about.
Yeah.
You're taking care of your daughter. Well, I noticed during the hospital time, my left tooth, man, was just bad. It was just something was off, and I don't know what it was. And I would brush and stuff, and it was just hurting. It was in pain. You just forget about that. You're worrying about your family, worrying about your kid, all that stuff. So finally, go to the dentist for the first time last year.
Oh, wow.
First time. And I said, hey, dentist, this is going on. What's going on? And they go, it's broken. I'm like, can you guys fix it? And they're like, no, we got to pull it.
Okay.
I'm like, all right. So they pull it. 2 months later, this tooth starts hurting.
Oh, good gosh.
And I'm like, what the heck, man? So I go to the dentist again. And they're like, hey, he goes, this is broken too. We can't fix it. We got to pull it. I'm like, you guys repairing it, right? They're like, yeah, we'll we got to wait till it heals. And there's a whole process for it. That almost takes a year.
Oh, good gosh.
For both, implant or crown that they're going to do.
Okay.
But for the last 8 months, man, it sucked, man. It's been, especially doing this show, like taking pictures and stuff like that, smiling. And man, I've hated life because missing 2 teeth right here.
Yeah,
they're not right here in the front, but it's like, it sucks, and I look at myself, I'm like, damn, I should have got this done before. I should have took care of this before. Because if I caught it before it got worse, they could probably fix it, put a filling or cap or whatever like they do. But now they got to pull it and they got to mold it and got to wait till it heals and the gum and all that shit. And they put a crown in and all that or implants. But taking care of yourself is so important, and us men, we like to be, oh man, I don't need to go see a doctor. I don't need to go see a dentist and all this stuff. And what happens is, and even someone told me, they're like, hey man, that's great. You're trying to take care of your family. But you remember you go on a plane, what's the first thing a captain says or a flight attendant when they're going to do the safety precautions?
I disagree though. I'm putting that mask on my wife and daughter first.
And some people do that and that's great. But here's the thing. If you're taken out, who's going to help your wife and kid? If I'm getting sick so bad or if I'm in pain or if I'm like in the hospital for whatever reason, no one's taking care of my wife and kid. You know what I mean? So in my head, I have to make sure that I'm getting checked out. I'm making sure nothing's coming up that I don't know about. Blood work done, whatever, to make sure I'm okay. Now, it took me some time to learn that lesson, but, like the pacemaker thing, you mentioned that. For years, man, I don't know how long I've had this, but I'd be running, I'd be working out, and dude, I'd be, and I run all the time, and I work out all the time with weights and weightlifting. Dude, I'll be out of breath after like 30 minutes, dude. I'll do the Spartan race. And I'll be out of breath more than normal. I'm like, what in the world? What is going on? Well, I found out through last year, my wife's like, hey, you got to go see cardiology. So I go to the VA, go see cardiology. And cardiology doctor goes, hey, we're going to do some echoes on you and testing because we could see something. We just don't know what's going on. Like, all right. So I go in for an echo. So I'm laying there, they're doing echo on my heart and all that. Well, the tech goes, are you okay? I'm like, yeah, I'm fine. Why? And she goes, I said, I'm tired. I got a baby that keeps me up all night. So, I'm like, I'm just falling asleep. She goes, no, she goes, you're going into cardiac arrest. Your heart rate's going down to like 20, 30 beats per minute. And I'm like, yeah, I've heard that before, but, they thought because I'm athletic and, my heart rate's like that. I've heard this before. It's crazy.
No, that's cool. Normal for me.
No, man, I'm a marathon runner. No, but it's crazy because she looked at me and she goes, listen, even marathon runners, people that run all the time, their heart rate's not even there. Yeah, they have low heart rates because they're athletic, but their heart rate's not even that low.
Yeah.
And so they go, so she calls in a cardiologist. Cardiologist looks at it and he looks at me and he goes, yeah, we're admitting you. And I'm like, you kidding me? And he goes, no, we're admitting you. And I'm like, okay, all right. So I call my wife. She thinks I'm joking. I'm like, no, they're admitting me in the hospital. So they admitted me. I was there for about a week.
Oh, wow.
And they're doing all kinds of testing on me. Finally, they came to a conclusion that you need a pacemaker. And they did all these wires. They saw my heart 24 hours, all that. They're like, you need a pacemaker. I'm like, man, I'm 40 years old. I just turned 40. I said I was 39 at the time. I'm now 40 now. I'm like, kidding me? I need a pacemaker? I'm like, how did this happen? They go, we don't know. They go, it could have been, you ever been in fights before? I'm like, yeah, I've been in fights. And they said it could be one punch or one kick to your chest that right in the minute your heart starts rhythming, it could kick it off. Rhythm, and just
No.
jack up something. I didn't know that. And that's one possibility. It could be 1,000 other possibilities. I'm not too sure. But they told me that. I'm like, okay. And they go, listen, we're going to call you for a surgery date for a pacemaker. I'm like, okay. So about a month later, doctor calls me up and he goes, listen, we have our normal pacemakers that we've done for years. I'm like, okay. And, or would you like to be a test subject candidate for a new pacemaker that's coming out by Abbott Pharmaceuticals? And I was like, well, what is it? And they're like, well, we're not going to go make a hole right here. They go, we're going to go through your thigh and put the pacemaker up through your thigh to your heart. It's two little, like smaller than AAA batteries, and they're wireless, and they run off of Bluetooth. I'm like, okay. So I started studying a little bit like you do. I was like, all right, let me see. And this is new. Like no one has done this, you know? So they told me that this is so new that I'll be number 3 in the entire United States to have this done. I was like, all right. So
that doesn't give me warm.
yeah, exactly. It did it. And
yeah.
I think I just said, give me the tried and true.
Yeah, try to
you know, and you know, that's the thing. They looked at me because they go, hey, you work out a lot, you do weights. I'm like, yeah. They're like, you're not gonna be able to do weights for months because of the wires and the healing and all that. And I'm like,
right.
I don't want to be out of commission that long. You know,
Because
I like
the old ones have the leads, right?
the old ones have the leads.
What I learned with
and all
yours,
that. And I'm like, I
yeah.
don't want to be out of commission that long. Like, come on, man. Like,
That
you
makes
know,
sense.
it
Right.
sucks. You know, you just being again. Okay, well, I'm done with the gym again for months. I hate that. I've already been through that too many times. I do not like that. And I was like, well, what's recovery time for this? Like a week. And then you go back to the gym. I'm like, perfect. You know,
Let's do it.
let's do it. And you know me, I like trying. I'm a risk guy. I'm a risk
Yeah,
taker.
you are.
So
I have
I'm
a
like,
question.
yo,
So the day that you were checking in and they said your heart rate is in the 20s or 30s and you're like fighting cardiac arrest, right? And you got to be admitted. And then they called you a month later for the procedure. What was happening in that month in between?
so pretty much I had to inform my work, and my wife knew, to pretty much have like almost a medic on standby at work. Even though I knew I had this issue for a while now, but now it's getting serious. So now the VA's
So
on
did they
red
give
flag.
you anything to like increase your heart rate?
Nothing. So they pretty much said, hey, not work out that much. Just kind of like calm yourself down a little bit. You know, just kind of watch it. I had my watch would notify me. They told me I couldn't drive, which sucked because I'm like, oh, that sucks. And they go, if you don't listen to us, we'll pull your license. I'm like, well, that
Oh, wow.
sucks. Yeah.
Yeah.
So I was like, okay, well, I'll listen to you guys. No big deal. Plus, Eliza hates my driving anyway, so she was happy about that.
Yeah, right.
So, you know,
I didn't believe
But-
this guy had a driver's license for a little while.
Really? Yeah.
Because every time I saw him, he was in the passenger seat.
No,
yeah,
you said
yeah.
back.
That was just a nice little
Or that
Uber.
too.
Yeah, so it's in the
nice
back.
little Uber
Yeah.
with, you know, it was nice. But, you know, so, you know, I get to the hospital and, you know, you guys were amazing.
So were you
Go
playing
through
Russian
this.
roulette for 30 days?
I
Yeah.
was pretty much playing Russian roulette for 3
Yeah.
days. Yeah. It was crazy.
Total
Yeah.
risk.
Yeah. And yeah, exactly. But, you know, it was crazy because, like, you know, we went in, you guys were increasingly helping Eliza out and our family out with food and helping us out, make sure we're okay. And you were there at the hospital. I appreciate you guys. But
Sir.
it was a few hour surgery,
Mhm.
you know, and it's crazy how I feel now, you know, having this new piece of technology in me that every time I go in for appointments, it's literally on my chart, 3rd patient in the United States that has this done.
That's pretty cool.
And I'm like, this is badass, but it's crazy how,
Got your iOS
how,
updated.
you know, it's
Yeah, I know,
crazy.
right?
It's
No doubt.
crazy, but it's crazy though, how it's Bluetooth too. That worries me.
I know.
Being, you know, doing what you do for
Trust me.
work. I'm like,
I know.
so
They
wait a
could
minute,
hack
it's,
it.
yeah, exactly.
Yeah.
Bump you up.
Yeah, exactly. Which is crazy because I'm going, all right, I don't know if this is good or bad, but
Right.
you know, when I go in for an appointment, all they do is just put a wire on me and they see all my feeds. And this is what's crazy about this too, is that, so a test, I have 2 of them, one upper and lower chamber. All right. Well, a test. So if my heart rate lows, you know, starts getting low, it pumps it up, right? It shoots electric waves and my heart rate is up. But when I'm working out in the gym, and I noticed this like 2 weeks after I started working out at the gym, I'm on the treadmill, I'm running and I'm working out with weights. I'm not feeling out of breath.
Oh,
And I'm
wow.
like, well, this is crazy. But what they didn't tell me, and they didn't tell me till my next appointment after that, like 3 months later after the surgery, is that the lower chamber, the lower pacemaker in the chamber detects when I'm working out and it pumps my heart up to measure what I'm working out with.
Oh, cool.
So if my heart rate's supposed to be at like 140, 150, it pumps up my heart rate to match to what I'm working out.
Oh, nice.
And so I noticed when I'm working out, I'm like, I'm not out of breath. I'm just like, wow, this is like, I felt like I wasn't even working out, but I was. I'm like, this is
So this
crazy.
dude's gonna embarrass me on this.
This
part,
is
ain't he?
badass. This is,
He'll be
I
running.
didn't-
I'm like,
so-
wait for me,
so
man.
this
Wait
is-
for me. I'm
This
out
is
of
my
breath.
first race. This is
Pump
my
me
first.
up.
I know.
This is my first race. This is my first thing doing after my pacemaker surgery, and it's
That is true.
Yeah, it's
Yeah.
crazy. So I'm excited. I'm excited to see what this is. Putting this product to
I'm a
test.
little worried, but yeah.
Yeah. So you got it, man. We're gonna be there for you. We're
Yeah.
gonna be there for you. But
No, I'm worried for you, fool. You're the dude with the pacemaker.
well, you guys are gonna be there. So
Yeah,
just
if
in
you
case
dream,
shit
you can
happens.
offer mouth to mouth.
Yeah.
I got you. Yeah.
No, there's no colonoscopy at the end. No happy ending for that.
No help. Yeah.
But no, taking care of yourself is important. Physically, mentally, making sure you're seeing doctors, dentists, whatever you need to see. It's important. You really do.
So for me, right, I have severe white coat syndrome. Right? Do you guys know?
No,
what
I
that
don't
is?
know what that is. What is that?
I
Mm-mm.
have severe white coat syndrome.
I know what I'm going to dress up for Halloween now.
I'm going to tell your wife to dress it up today.
Watch out now.
I don't know what it is. If it's like the kid in me, right? So I'm a big guy, right? As a kid, I was big before I really knew what weights was. So I was an unhealthy big, right?
Okay.
So every time I would go to the doctor as a kid, it was like, you should weigh 110 pounds right now. You're about 280, right?
Yeah.
Mhm.
So it's like red flag all over, right?
Okay.
So I feel like that traumatized me in life.
Okay.
Right? I'm not even gonna lie.
No, that makes sense, man.
So every time I would go in, after we go through the whole Rhythm of Row, like you got this wrong, this wrong, this wrong. We got to do like blood work, make sure everything's fine. And then after they're telling me all this, they're like, basically making me feel like as at a 12-year-old, like, oh, I'm about to die, right?
Right.
Right.
They're like, let's check your blood pressure. So they check it. My blood pressure is crazy high.
Yeah, because you're all scared.
And then they're like, well, how high your blood pressure is, we need to do an EKG on you. So
Poor
this would
kid.
happen every
Damn.
time I would go to the
Oh,
doctor
wow.
as a
Damn.
12-year-old,
Oh,
Right.
my
a
goodness,
13-year-old,
man. Yeah.
a 15-year-old. And I'm like, I don't want to go to the doctor.
Right.
Like, I would
Okay.
rather not go to the doctor.
Yeah.
So I went to the doctor at 16, and they told me I was 295. And they told me, you got to lose weight or you got to go on blood pressure medicine, right?
Are you serious?
Sheesh,
Yes,
man.
at 16. So I dropped 45 pounds or 50 pounds my freshman and sophomore year. So I got down to 245, right?
Wow.
Checked my blood pressure. You're good to go, right? All right. So I didn't go to the doctor for years. Right in my early 20s, I had to go to the doctor again. And that thought just started creeping back into my mind of teenage me going to the doctor. And I just absolutely hated it, right?
Right.
Yeah.
So I got to the doctor. Sure enough, checked my blood pressure. It's through the roof. Right.
Oh, good gosh.
What do you do then? You got to go on blood pressure medicine.
Sheesh,
Right.
man.
So I actually was on blood pressure medicine for some years.
Oh wow.
For some years.
Oh, man.
Um,
Damn, I didn't know that.
and then I got my most recent doctor, because this is new. Dr. Doring, right? He was like, check me out, check my blood work. He's like, man, everything's great. Like you're in you're in good shape. Everything's good with you. Like, I think you could maybe get off blood pressure medicine with a little bit of tweaking, right? Like you're almost there. He's like, I'm not one to put medicine on you. I'm one to say, if we can get you off of it, let's get you off
Yeah,
of
I
it.
like
right.
that.
And I'm like, that's what I want, right?
Yeah, yeah.
So then we got to, I ran, it was before my half marathon, but it was like 2023, the beginning of it. I got down to like 270, right? And I was just feeling good, looking good. Everything was good. And then I started getting dizzy. So this was last year. I would get really dizzy, just dizzy spells, right? Went from sitting down to standing up, or standing up, sitting down. Like I'd feel like the room was spinning. And I'm like, okay, something's going on, right?
Yeah.
So I would check my blood pressure. My blood pressure was like 105 over like 50.
Oh, wow.
Super low.
Super low. Yeah.
So then I was like, okay, let me stop taking blood pressure medicine, right? I stopped taking it for about a month. And every day I would take it. 120 over 70, 125,
back to normal.
75.
Yeah.
It was good. So then I went to the doctor, I didn't tell him anything. He took my blood pressure. It was about 190 over 120.
Sheesh, man.
And he's like, okay, what's going on? I was like, listen,
It's a stress from work.
let me show you these pictures on my phone. So I pulled up about a week of blood pressure readings at home. Perfect. And he said, okay, so you have severe white coat syndrome. So the reason you're getting dizzy is your blood pressure is not actually high, and we're medicating you to lower your blood pressure, and your blood pressure is going
It's
too
when you
low.
go there, you get all nervous and it's going on.
Exactly.
Hey,
So when
you screwing yourself.
So when I get there, it looks like, hey, we need to bump up your blood pressure medicine.
Yeah.
So after that situation, an understanding doctor that was like, let's look at the bigger picture here, not just what's in front of us.
Wow.
I got taken off of blood pressure medicine because I didn't need it.
That's amazing, dude.
Wow, that's crazy.
So
man.
I've just, I've never had a good history with doctors.
Yeah. No,
Yeah.
I get that.
There's
I get
no-
that. You ever thought like have Ariel dress that up at night to
Kinda
kind of like
help
trick
you
your
with
mind?
that?
to
Make
kinda
you a
help
little
you with
nervous?
that?
No, oh, well, I mean,
You know, I mean-
depends.
She needs a colonoscopy.
Let's go. Happy Women's and International Women's Day.
Ariel makes me nervous outside of that.